Inflammatory and infectious conditions of the eye. So inflammation can happen because of so many things. It can be from allergies, it can be from infection. As you know, it is a normal or expected immune response. Inflammation of the eye can be a sensitivity response. Again, it can be from allergy due to the histamine release, which is a mediator of inflammation. So it causes itching and more secretions, as well as literally swelling in the eyes. At times, it can be from infection. So the most common infection of the eye is from your Staphylococcus, Streptococcus, Haemophilus pseudomonas. So that one specifically is an infection that often happens with contact lens wearers. Selected conditions. So conjunctivitis is also known as pink eye. So it's basically the inflammation of the lining of the eye. So you can see this guy right here, he has conjunctivitis. So you see there's redness, and so the lining in the eye is actually quite swollen or inflamed. So pharmacological treatment of conjunctivitis, usually it is dependent on the cause, right? So if it's from an infection, then we expect to administer antimicrobials. If it's from just some sort of other condition that causes inflammation, then we may just administer anti-inflammatory agents. And at times, if it's caused by allergies, then we may need to administer antihistamines. So let's start with antimicrobial agents. Antimicrobial agents, mechanism of action is going to be the same thing as what you've learned under your antimicrobial agent units. So the main thing is they can be bactericidal or bacteriostatic depending on which agent that we are talking about. So the effects are very similar to the systemic agents. The therapeutic effect is prevention or treatment or eradication of infection. Do you guys remember what is the term that we use when we're talking about preventative treatment? Preventative means prophylaxis. Anyway, I was just testing you guys. So therapeutic effects include prevention or treatment of infection. So indications or possible exposure to infection, or possibly the patient already has an identified infection. And again, prophylaxis. So let's say a patient is going to undergo some sort of surgical procedure of the eye, then we may give this prophylactically. Precautions and contraindications, that will depend on which agent. Side effects. So side effects of antimicrobial agent, most often that would be localized inflammation or inflammatory response. So possibly some stinging, burning, and maybe more inflammation after initial contact. Something that we may have to think about is at times if we give certain agents, the effectiveness of these drugs can go down. So we have to just be careful and really get that thorough medication history and try to do our own little research about, let's say, if these are compatible, if there's any interactions, maybe decreasing the effectiveness, then we may need to collaborate with our physician and let them know what we found. So nursing actions, as always, we assess for therapeutic and side effects, and patient education, especially the correct use and the duration, especially with antibiotics. One thing that we have to let them know that even though their symptoms had improved, we need to make sure that we complete the full antibiotic course, and that still applies with eye drops or ointments. Examples of drugs under this class, you have erythromycin, which is a macrolide, and you also have moxifloxacin, which is a fluoroquinolone. Anti-inflammatory agents. The mechanism of action of anti-inflammatory agent is basically the action on the arachidonic acid pathway, which is a pathway involved in inflammation. So it blocks the phospholipase or arachidonic acid, therefore decreasing the inflammatory response. The therapeutic effect of an anti-inflammatory would be decrease in inflammation. So indications for these drugs include corneal and conjunctival injury, seasonal conjunctivitis, also decrease in surgical trauma. So possibly a patient had surgery and we expect them to have some inflammation or swelling in that area, then we may need to administer these anti-inflammatory agents. In addition to that, anti-inflammatory agents can limit scarring in that area. So if we administer this, especially some immunosuppressants, then it will prevent scar tissue formation, and hopefully that will prevent possible complications that will impair the patient's vision or even comfort. Precautions and contraindications. These are not recommended for minor abrasions because it may decrease the resistance to infection. Side effects include locally burning and stinging. And something to remember is that the steroid agents may induce cataracts, nerve damage, and actually increase intraocular pressure. So that's something to remember. And so if a patient has been on steroids, we may need to make sure that they're just on it short term if possible. Nursing actions. Nursing actions include assessing for therapeutic effects and side effects. Patient education includes correct use, the duration, and also make sure that they don't rub their eyes, right? Because that can actually, one, cause more trauma, and two, it may increase the effect or decrease the effect of the drugs. Examples of drugs under this class. So actually, this anti-inflammatory, it can be so many different drugs. So we have our NSAID, which is our ketorolac ophthalmic. So ketorolac, I know that you guys have seen or heard about that before, right? So that's your NSAID or non-steroidal anti-inflammatory drug. You also have your prednisolone ophthalmic, which is a steroid version of that eye medication. Cyclosporin ophthalmic is an immunosuppressant that also helps with inflammation, and at times you may see combination drug, which are combination of anti-inflammatory and antimicrobial. So an example of that is your tobramycin dexamethasone ophthalmic. So this medication is a combination of the aminoglycoside tobramycin and the steroid dexamethasone. As mentioned earlier, there are instances that we have to give antihistamines. So the mechanism of action of antihistamine is by competing for histamine receptor sites, therefore limiting the release of mediators from the mast cells and decreasing that inflammatory or allergic response. The therapeutic effect would be decreasing in those signs and symptoms, right? So that would be decrease in itching, redness, tearing, maybe decrease in swelling. Indications, usually these are given for allergic conjunctivitis. So this is an inflammation of the conjunctiva secondary to allergies. And you also have your seasonal or allergic keratitis. Keratitis is the inflammation of the cornea. Precautions and contraindications, these are dependent on the agent. Side effects, main thing is localized burning and stinging. Some nursing actions, always assess the therapeutic effect and side effect, and patient education, the correct way of using it, needing to follow up with treatment, and the effects of rubbing their eyes. Example of drug under this class is your Patanol or olopatadine. Next, we're going to briefly talk about trauma to the cornea. So there are different sources of trauma. One can be external, right, from the actual trauma. Maybe you accidentally scratch your eyes. Maybe it's from an accident. Maybe somebody got attacked. Anyway, so that can cause corneal trauma. At times, it can be internal, so maybe from wearing contact lenses, and at times from administration of neuromuscular blockade. So neuromuscular blockade will stop you from blinking, therefore causing dryness in the eye, which can possibly lead to a corneal tear. How do we examine or diagnose a corneal tear or trauma or even foreign body in the eye? What they would usually do, so the providers or the specialists will do, is administer fluorescein. So fluorescein is an ophthalmic dye that they use with a slit lamp examination. So a slit lamp is basically a specialized lighting wherein the fluorescein can be seen, like this one right here, like a fluorescent color. And so depending on the color and the areas where it lights up, then it can help the provider determine the presence of trauma or possible foreign body in the eye. So this is an example of that. And so again, that ophthalmic dye is called fluorescein.